We automate the verification process from the start in order to put the doctor in control and make their career life cycle easier. This will improve job mobility and create practice autonomy while reducing administrative burden for doctors. My name is Dr. Leah Houston, and I'm an emergency physician. And I worked in 14 different health systems in 3 different states. And the administrative friction that I experienced during onboarding to those different hospitals was a nightmare. And so as doctors, we all know how awful the credentialing process is. So we're going to fix it by automating workforce mobility for practicing docs. So this disclaimer is required because we're planning for a crowdfund and it hasn't launched yet. So please just take note of that. So there's a physician shortage. And so this barely visible light blue line on the bottom represents the growth in the number of physicians since 1975, compared to the growth in spending and the growth in administrators. So with each new regulation, there's been an increased cost to the point that now only 30% of every dollar actually goes towards patient care. And doctors are leaving, and there's not enough graduates coming in to fill the gap. So we've all noticed that there's actually a shift in workforce behavior for everyone. Everyone wants more job autonomy, freedom of mobility, and control over their work schedule, and doctors are no different. But this is how we feel, and this is how our patients feel. We're no longer independent, we're employed, we're being micromanaged, and we're quitting at a faster rate than ever predicted. And we know that the path to becoming a doctor is long and cumbersome. Each step to testing, qualifying, training, credentialing creates friction that follows us throughout our entire career because these steps have to be repeatedly verified over and over in order to get and keep a job. And current systems depend on physicians spending countless hours entering and uploading their information. So then, without our explicit knowledge or consent, these systems sell our data and generate tens of millions of dollars a year in revenue. And even though this is the physician's data, we don't see a dime of that. So as a company, we automate the verification process from the start in order to put the doctor in control and make their career life cycle easier. This will improve job mobility and create practice autonomy while reducing administrative burden for doctors. So HPEC is a workforce mobility solution that allows each individual practicing doctor to own their professional brand in order to move freely. So we have 2 interoperable products. So Evercred issues and authenticates identifying information at each step of a doctor's training and licensing. And HPEC is a digital identity wallet that gives us control over our professional information so that we can control our right to work and move freely between systems. So both of these products are built on open, decentralized identity standards, which are going to be horizontally applied across industries for the future of Web3. And we're building a marketplace, and that's part of why we've built both sides of this marketplace. So we have a one-of-a-kind product, and we are first to market, so we have first mover advantage. There are hundreds of other credentialing companies that solve this problem downstream. We're the first and only company that's solving this problem upstream, creating an automated digital solution at the time that credentials are initially issued. So this is a rare moment in history where technology trends are following regulatory trends. And so we mentioned that the TAM for credentialing is $5 billion, which is where we're going to start as a company. But the entire US healthcare system is a $4.2 trillion system. And the physicians control 80% of the flow of that capital. So our transparency first system can empower doctors to reduce fraud, waste, and abuse throughout the entire healthcare system. And so this is just a small snapshot of the journey that practicing doctors take and the systems that they interact with. Every single one of these systems needs to authenticate physician identity first, and automating that process is how we feel will serve or potentially replace some of these. And this effort has been fully funded by the physician community so far. We've raised $500,000 from practicing doctors on a crowdfund, and we use that to launch our beta product that now has close to 1,000 physician members representing over 100,000 patients. We're also building partnerships with credential issuers with a clear path to revenue, so we're ready to scale. And so we have 2 partners with ACGME approved residency programs where they're going to use the Evercred system to actually issue residency certificates to graduating doctors. And we also have an agreement with a telefingerprinting company that holds patents to do remote fingerprinting globally. They also have agreements with all 50 state licensing boards. So, we have the opportunity to kind of speed up the cross-state licensure process with these guys. And this is our dedicated and passionate team. And this is the future that we're building, and we're asking you to join us. So when we start our next round, we'll be looking for value aligned capital partners. So please visit our website to learn more and stay in touch with us.
Awesome, Dr. Houston. Appreciate that. Give us a little more details about the revenue model. How are you going to make money?
So, we're not going to be changing the workflow for anyone, but, we have this slide that kind of explains, right now when I graduate, I get a paper credential. With the Evercred system, I get a digital credential. And so when I get a job or I want a credential with an insurance company, they first have to ask me for information. So that workflow is not going to change. So when I share a digital credential through this system, we as a company hold that under smart contract until all transactions are made. So with that digital credential comes a request for payment, and the verifiers who are already paying an average of $3,000 per credentialing event will continue to be happy to pay. And then as soon as that payment is made, the digital credential is released along with provenance and proof of where that credential came from, automating that process, reducing that 4 to 6 month process down to moments. And then we are going to build out the ecosystem and build out this marketplace by actually returning some of that capital back to the holders and the issuers. So the verifiers already pay, they'll continue to pay. The holders and issuers, it's their data, they deserve to earn something too. And we as a company will provide the service and take a fee.
Got it. You talked about the issue of friction and the headache of credentialing, but it really makes me think about the downstream cumulative effect of friction and headache. And I think about the nursing strikes that we saw in New York City, and just the way that friction becomes burnout, becomes a true mental health burden. So could you talk a little bit about sort of the bigger health implications in the lives of physicians of friction upon friction upon friction?
Yeah, I mean, anybody in the audience who's had to see a doctor recently who doesn't have some kind of an in or family member that's helped them has probably experienced some form of friction or frustration, either with appointments taking forever or seeing the wrong doctor and being told that they need to make an appointment with a new one. Because all of these processes are still paperwork based, everything's still on fax. So, we as a doctor, we took a Hippocratic oath and we're here to serve. And the current system is not up to date. It's not digitized. And so, this is something that can automate and streamline your access to practicing physicians and other practitioners that you need.
All right. And in 60 seconds, you mentioned that this is a marketplace approach. You have this grander vision. What's one opportunity you see through building a marketplace, and sort of an extended opportunity?
So we mentioned that only 30 cents of every dollar goes to actual healthcare. Imagine if you're a company paying some third party like United Healthcare millions, hundreds of millions of dollars sometimes to administer your healthcare, and you know that only 30 cents of all of your money is actually going towards that care. Imagine if you could put that capital into a decision engine where your employees could choose a doctor of their choice, or if you're an independent contractor, you can choose a doctor of your choice. And as soon as that handshake is made, as soon as that data is transferred, as soon as that encounter is complete and my operative note or my encounter report is completed, I give you your data and I get paid immediately at the time of service. Imagine how much money can be saved if all of the administrative burden around revenue cycle management and all of the essentially executive and shareholders pocketing that other 70% of capital is eliminated or reduced with a streamlined and automated system like this. That's a future that we see.